Delay, Deny, Defend report the tragic death of a high-profile CEO in a workplace violence incident has brought attention to an issue that has long been festering beneath the surface: the systemic failures of insurance companies, healthcare systems, and corporate agendas in America. For years, injured workers, patients, and advocates have been crying out against the unjust practices of delay, deny, defend used by insurers to deny rightful claims, leaving countless individuals to suffer needlessly. The reality of denial: insurance companies have built their profits on tactics that prioritize corporate gains over human lives. Workers injured on the job, veterans seeking VA benefits, and patients navigating private health insurance or SSDI systems often face insurmountable obstacles. Denials, delays, and legal loopholes create a perfect storm where people are left without the care and support they deserve. This culture of denial is not limited to one sector. It permeates workers' compensation, private health insurance, veterans care, and even Social Security disability insurance. It's a pervasive system designed to exhaust claimants into giving up, and it's causing real harm. The role of lean corporate agendas and privatized systems: the rise of lean corporate agendas, designed to cut costs at all levels, has further exacerbated these problems. Lean systems often prioritize profits over safety, stripping away critical safeguards that protect workers and patients. Additionally, the increasing privatization of essential systems, from healthcare to vocational services, has created a for-profit model that often harms those it is supposed to help. Private entities, driven by shareholder interests, prioritize cost containment over care, leaving injured individuals to bear the burden. Deregulation and its consequences: deregulation has played a significant role in enabling these harmful practices. By loosening oversight and allowing corporations greater control over essential systems, state and federal governments have created an environment where abuses thrive. Deregulated industries often lack accountability, allowing insurers and medical boards to operate with impunity. This has led to a growing distrust in these systems, as the public sees profits prioritized over fairness and justice. Doctors used as tools of denial: the critical, yet often overlooked, aspect of this crisis is the role of medical professionals and boards. Under state medical tort laws, doctors are granted immunity, even when their evaluations and decisions result in harm. These same doctors, frequently incentivized by insurers, provide justification to deny claims, turning healthcare into a weapon against the injured and vulnerable. Meanwhile, medical boards, which should provide oversight, fail to act, further perpetuating harm and injustice. What makes this even more egregious is that while injured workers and patients face criminal charges for expressing anger or frustration, those responsible for these systemic abuses, from doctors to lawmakers, are rarely held accountable. This double standard highlights the deep power imbalance in these systems. Silence from influential voices: injured workers and advocates have been crying foul for over a decade, yet their voices have largely been ignored. American journalists and authors who write about inequality, such as Tom Hartman and Chris Hedges, or politicians like Seattle's socialist Kshama Sawant, have failed to address how healthcare systems and workers' compensation schemes are being weaponized. While these figures champion broader systemic reforms like Medicare for all or single-payer systems, they remain silent on how current systems are being manipulated to harm one class over another. This silence is deafening, especially as insurers' profits soar while injured workers face homelessness, poverty, or worse. The narrative around healthcare reform often omits the stark reality that these systems, under their current structure, are actively harming the very people they claim to serve. Federal oversight is essential. State laws, often influenced by elite corporate interests, have created a patchwork of protections that vary widely and often fail to safeguard workers and patients. To address this, we need robust federal laws to police state systems and ensure that the elite cannot exploit these laws for their own gain. Federal oversight is critical to standardizing protections, holding medical professionals accountable, and ensuring that no one falls through the cracks of a fractured system. A system bound for collapse. The consequences of these systemic failures are dire. Families are left bankrupt, patients are denied life-saving treatments, and injured workers are forced into poverty. And, as we've now seen, the anger and frustration generated by these injustices can boil over into tragic violence. For years, many have warned that this systemic neglect and exploitation would lead to devastating outcomes, and now, those warnings have tragically come true. The need for change this moment should be a wake-up call for America. No one is immune from the consequences of a broken system, whether they're a laborer on the factory floor or a CEO in a corporate office. It's time to demand transparency and accountability, and the immunity for medical professionals and boards when they act in bad faith to deny care. Fair compensation systems implement federal oversight to ensure consistent, fair workers' compensation and SSDI practices across all states. Stronger regulations for insurers stop the delay, deny, defend culture by enforcing stricter penalties for unjust denials and delays. National standards for care guarantee equal access to medical care and benefits, regardless of state or employer. Policing corporate influence enforce laws that prevent corporate agendas from undermining worker and patient protections. Support for federal oversight create a unified system to police state laws and ensure elite interests cannot override the rights of individuals. Accountability for silence call out influential figures who have failed to address these injustices and demand that they speak up for injured workers and patients. A call to action. The tragic loss of life should not have been necessary to spark this conversation. However, this moment presents an opportunity to confront the systemic failures that have plagued America's injured workers and patients for decades. Real change requires collective outrage, action, and a commitment to holding insurers, medical boards, and lawmakers accountable. This is not just about one tragedy. It's about the countless lives that have been lost or irrevocably damaged because of a system that values profits over people. Let this be the turning point where we demand better for every worker, every patient, and every family in America. Proverbs 31 verse 9, speak up and judge fairly, defend the rights of the poor and needy. Founding Father quote, Thomas Jefferson, the care of human life and happiness is the first and only legitimate object of good government.